Advances in child psychology. Child psychology has seen significant advancements over the past few decades, with research expanding our understanding of how children develop cognitively, emotionally, and socially. These developments have profound implications for educational strategies, parenting styles, and therapeutic approaches tailored to help children thrive. Cognitive development. Recent studies in cognitive development have emphasized the role of executive functions, which are crucial for decision-making, problem-solving, and behavior regulation. These functions begin developing in infancy and are heavily influenced by interactions with caregivers and the environment. Innovative techniques in neuroimaging have allowed researchers to observe how neural connections in children's brains strengthen as they engage in tasks that require executive functions. This research supports interventions that enhance cognitive development through structured play and problem-solving activities. Emotional and social development. The understanding of emotional regulation and social development in children has also advanced. Psychologists now emphasize the importance of emotional intelligence, which includes the ability to recognize and manage one's own emotions, as well as empathize with others. Studies have shown that children's emotional and social skills are predictors of their future success in school and personal relationships. Programs that teach these skills are being integrated into school curriculums around the world. Influence of technology. With the rise of digital media, researchers have been focusing on the impact of screen time on child development. Findings suggest that while moderate use of technology can be beneficial for learning and development, excessive use may lead to issues like attention deficits, reduced physical activity, and impaired sleep patterns. These insights have led to guidelines by health organizations on the appropriate use of technology for children at different developmental stages. Interventions and therapies. Advances in understanding developmental disorders such as autism spectrum disorder, ASD, and attention deficit/hyperactivity disorder, ADHD, have led to earlier and more accurate diagnoses, along with more effective interventions. Behavioral therapies, sensory integration therapy, and social skills training are some of the approaches that have been refined to better meet the needs of children with these conditions. Parenting and educational practices. Research has also transformed parenting and educational practices. There is now a greater emphasis on the style of attachment between parents and their children, with secure attachment being linked to better social outcomes in children. Educational psychology has contributed to more effective teaching methods that accommodate diverse learning styles and needs, promoting inclusivity. Ethical considerations. With the increase in research involving children, there has been a corresponding focus on ethical considerations. Ensuring the mental and physical safety of child participants in research is paramount, as is respecting their rights and those of their families. This includes obtaining proper consent and making sure that the benefits of research outweigh any potential risks. Conclusion. The field of child psychology continues to grow, driven by technological advancements and a deeper understanding of the complex factors that influence child development. By applying these insights, society can better support the next generation in reaching their full potential, both as individuals and as members of the community. As we continue to uncover more about the developmental processes, it is crucial to adapt our educational systems, parenting practices, and therapeutic approaches to align with these findings.